Pregnancy-related anemia has been classified as a global nutritional problem affecting more than 50% of the pregnant women globally. This is in both developed and developing nations. This means that in every 2 pregnant women, 1 is actually anemic. That is very bad because the dire effects of being anemic when you're pregnant are serious, especially on the cognitive development of the baby, and these deficiencies are usually passed on to infancies if interventions to correct the situations for the mothers are not put in place early enough. This is quite a sad state of affairs, and it is about to get worse in developing nations like Kenya, with the increasing rates of food insecurities due to the failing rains, climate changes, crop failure, global economic recession that is affecting everyone, even farmers, which will compromise the availability and the quality of the foods that we have for our women. It is more risky for a woman to be anemic during the first few weeks of her pregnancy because it has been linked to intrauterine development issues like spina bifida, cognitive functions delays and such. It is easier to correct iron deficiencies effects later on in pregnancy or during breastfeeding than during the first few months of pregnancy. This is why women are told to go to clinics immediately they discover they are pregnant, or to start on iron and folic acid supplementation before you start on trying to conceive, to ensure that you prevent the effects of anemia on the development of the fetus when you get pregnant. Fortunately for us, most of the women that have iron deficiencies usually are symptomatic, and one of the symptoms that they will exhibit is going out of breath. Anemia is one of the reasons that women faint when they are pregnant, or poor appetite, too much infections. Of course, when you don't have enough blood supply, you are bound to get infections because of limited supply of nutrients to the various systems and sites for activations. So what are some of the things that will predispose a woman to anemia when they are pregnant? The first thing is inadequate dietary intake of iron and folic acid. The food sources of iron are basically green leafy vegetables, all the heme sources of iron, all types of meats. We have seafood, omena, we have beef, pork. Animal sources of protein are the most bioavailable sources of iron, and they provide it in good amounts, easily absorbed into our system. So we also have iron in fruits and vegetables, the skuma, the terere, the managus. We also have iron in eggs, legumes, and plant-based sources of protein. We have it in beans, we have it in jahe. Jahe is a very rich concentrate. Mbaazi, we have some trace amounts in dengu, they are there, yes. And in most cereals, they're actually fortified with iron. We have grains. This is why when you're pregnant, you're usually told to make sure that you consume variety of foods so that you can get the different nutrients, the different minerals, trace elements. Because if you consume one particular type of meal, it is quite dangerous because it will mean that you're limiting the quantities and the qualities of the nutrients that you're going to consume when you're pregnant. The second thing that will cause a woman to have anemia is infections. Nutritional related deficiencies like anemia usually have a symbiotic relationship with infections. When you have infections, your nutrient requirements usually go high, and this means that your nutrient intake needs to be higher. Most people do not factor that. They continue the same diet plan. You will be taking up less amounts of the nutrients or less amount of the iron. Most people usually don't increase their intake or supplement or take up fortified or enriched foods. When you're sick, you'll need more nutrients, you'll need more calories, you'll need more energy and such things for the body to fight off the sickness. Another reason why a pregnant woman is at risk of having anemia is because there's increased blood needs. She's pumping blood for 2. When you're pregnant, your metabolism is heightened, so how your oxygen and how your blood is transported to cells and tissues is also heightened. Another thing that you would want to do when you're trying to make sure that you increase your intake of iron is also increase your intake of sour fruits. It is advisable for pregnant women to ensure that they increase their intake of sour fruits or acidic fruits, things like lemons, things like oranges, apples, mangoes, because they provide an acidic medium for the absorption of the iron that you've consumed in the intestines. Because you can take up the iron, but if it's not bioavailable and the medium for absorption is not right, it will not be taken up to be utilized for blood formation and other functions. This is one of the reasons that women are usually advised to ensure that they take care of their meal planning when they are pregnant, combine their meals effectively with all the nutrients, all the vitamins, all the minerals, all the mediums, that is acidic, basic, for maximum absorption of the specific nutrients that are needed during pregnancy. Some women experience bleeding all through the pregnancy. This can also be a cause for alarm. Another thing that will cause a woman to have anemia is too much vomiting. If you're having nausea, it's also a sign and symptom of anemia. It can also lead to the anemia, if you're not eating enough, if you're having too much morning sickness. Some of the risk factors that are associated with anemia in pregnancy, we have low birth weights, intrauterine growth retardation, whereby the baby is born not being fully developed in other areas, like you can have maybe the brain is not fully developed, the cleft lip, some areas like not closing up well because the mom's body was not in a position to supply enough nutrients during formation, and this is a very risky thing. We are a developing country. We are faced with a lot of problems in terms of food security. All these have affected the food availability for most households. Most people usually survive on 1 or 2 meals. And you see, when you're pregnant, your nutrient demands are high. You might need more than 2 meals to ensure that you meet up all the nutrient demands, all the micro and the macros that are needed. So if you are pregnant and you see the food security is a problem, again, this is another reason you need to make sure that you go to your clinics, because the government, through the Ministry of Health, they have the blanket supplementation program whereby they're supplementing women with IFAS, iron and folic acid supplementation. I know the side effects are not so pretty, the nausea, the constipation, the vomiting, but if you understood the importance of taking up that iron, you will actually withstand or familiar the effects, because it's only a few months and then the fetus passes that stage. The other developmental stages, you can try as much as you can with your dietitian or with your healthcare professional to try and ensure that your dietary intakes are as rich in all the nutrients as they can be, to make sure that you get enough. Remember this, only a very small percentage of women usually meet their pregnancy needs through diet. Even the dietitian professionals are taking the supplements. Try as much as you can to do this for your baby. At the end of the day, what we usually want to achieve is a healthy pregnancy outcome, healthy mama, healthy baby, to break the vicious cycle of malnutrition. Another thing that will predispose a woman to anemia is worm infestations, the minnows and such. They eat up the food that you're giving your tummy, so you end up not having enough to absorb and assimilate to your system. And when this happens, you will have less stores to be utilized for blood formation, oxygen transportation. You improve your iron intake. Also make sure that you supplement. It is very, very necessary. I know the pregnancy hormones can be all over. You might not be feeling like you want to eat. You might be feeling like, oh, today, no. But just try as much as you can. What you can do about the supplements, if you vomit in the morning, you avoid taking the supplements in the morning and then you take them at night. Because most people usually complain that if I take them during the morning, I'll have a bad day, nausea, vomiting and such. If you can take them 2 hours after eating, because you don't want to vomit the meals that you've eaten. So make sure that you eat your meal, give yourself 2 hours, let it digest, let it start being utilized by the body, then you can take up your IFAS, then you go to bed. That will be very helpful, and it will help in reducing the vomiting and such things. If you are in a position to procure and buy other brands, you can actually do that to ensure that you get the adequate supplementation that is needed during pregnancy. What are some of the consequences of iron deficiency to the mom? You risk getting pre-eclampsia, excess bleeding and such, because you will not have enough platelets to stop all that. For the mom, iron and folic acid deficiencies has been linked to a lot of postpartum depression, how your mental functions and all that, because iron is a nutrient that is taken up a lot by the brain. If your iron stores are low, you are predisposing yourself to postpartum depression after delivery. This is not the main cause of postpartum depression. Of course, there is the overwhelming aspect of motherhood, but it is a factor, and so it is important that you take care of your IFAS during pregnancy. You also recover well after delivery, because you see, when your iron stores are good, even when you're going to deliver, because you're expecting to have blood losses and such, you will recover better. You will reduce your hospital stay. You will reduce infant iron deficiencies. Babies born to moms who are iron deficient usually get the iron deficiency. When you, as the mother, you are iron deficient, your breast milk is not going to have enough iron stores to nourish the baby. So it is important to ensure that you take care of your iron stores when you're pregnant for the betterment of you and the baby. And please watch this video on nutrition and pregnancy, and let's meet there. Thanks for watching. If you found this video useful, please give it a thumbs up, and please subscribe if you have not, and let's meet on the next video. Bye.